Hello, everybody. Welcome to our YouTube channel and our webinar. We are transmitting direct here in Facebook. Today's topic interesting for English people, English spoken. Yesterday I did it in Spanish language, and a lot of people said to me, "Why you do only in Spanish?" And I try to do the same webinar than yesterday, but in English. We will talk about something very important, that is clinical cases in posturometry. And that is a webinar for people who are interested in physical rehabilitation and people who are dedicated to TMJs, also rehabilitation of the body, osteopath, physiotherapists, medical doctors, etc. Some of you will be in direct. We are transmitting here in LinkedIn and also in YouTube, two different socials. You will see later also in our web app the registration of this webinar. Let me talk about this fantastic topic, that is the posturometry and stabilometry. I don't know if you know what is posturometry and stabilometry, but I try to introduce all of you in this topic, and also in the posturometer, the tool we use to measure this fantastic posture. You know, posturometry is the way to transform the clinical opinion in science. And don't forget it. Transform clinical opinion in sciences. Let me put the presentation on the top for everybody. And this guy, I think most of you know, Galileo Galilei, was the Italian guy who was saying that the Earth was not the center of the universe, this particular guy. And obviously, the whole people in this era going against him. What happened? He said, because if it's not, they kill him, because it was against the normal concept. He said, yes, you are right, but eppur si muove. What means in Italy? But it's move. And that guy was the first one who was against the normal. And we said now, because he cannot prove it, he has to say that. But if you measure everything is science. And that's why it's important to understand posturometry. For the people who don't know nothing about posturometry, I would want to introduce something very, very, very little introduction in posturometry. And it's a question. And I tell all of you, what do these people have in common? And I really sure that if we are talking together, you give me a lot of things. The body isn't that way, was it not good posture, there is not something right, you see the posture, you see the arms. No, the answer to that question is this one. All of them are searching for the best possible body center of the body, obviously. And why? Because when we have our body center closely to the center of gravity, our body uses less energy. That's why. And to do that, to obtain the real center of gravity, perfect center of the body center, we have to have efferents and afferents. Well, that means information who arrive to the brain, the central nervous system, and the information is going out have to be in balance. Why we say that? Because that information is arriving to the central nervous system through the receivers. You know, people who follow me in my lectures, they know that is important, the oculomotor system, vision and movement, the craniofacial system, foot support have to be in good balance. If they are in good balance, our body will be in balance. But if they are wrong, the system works still and the posture is bad. Look at that, posturometer, the way to measure the posture. This device is an objective device. I try to explain shortly what is the concept, because if it's not, nobody will understand the lecture. And we see that. Look at this device is the way to measure. In our protocol, we said this is the posturometry and stabilometry is the instrumental diagnosis of the MPR. This device is based in the concept of Kepanji. People who is physiotherapists or osteopaths, they know very well Kepanji. Kepanji is a physiotherapist who discovered who studied how is distributed the body weight in each foot through and vertical to the external, the malleolo external, external malleolo is distributed in the first metatarsus, fifth metatarsus, and calcaneus in exactly that percent. 6% calcaneus, 5%, 1/6% fifth metatarsus, 2/6% in the first metatarsus. That is the distribution. And the posturometer has a sensor in these three areas. The measure we do is a protocol, basic protocol, that is mouth open, eyes open. Second measure is mouth closed, eyes open. Third measure, mouth open, eyes closed. 3 exams, 30 seconds. In 30 seconds, you will have the measures done. And what we measure? In the first, we measure the posture. Second, we measure the effect of the craniofacial system. That means the occlusion, the jaw position into the posture, and then the foot support. And then what we look to analyze the foot support, what we have to look. I try to explain through the posturometry how you can individuate the problem, and how to identify the problem. We study in the posturometer 2 kinds of exams. We compare mouth open, eyes open, mouth open, eyes closed. That 2 exams cancel the negative effect of the craniofacial system. And we can observe exactly if the foot support is good or not. But what we have to observe in the standing position of the center of gravity, we study the center of gravity. You see that? The overlap of the center of gravity in the two tests, here and there. And obviously we do a clinical observation, yes. We do the clinical observation of the foot support just to compare clinical diagnosis and stabilometric diagnosis. The front of the foot and the back of the foot, and we study, we analyze. And when we see that trace, this very center is varus, this very center is varus, it's harmonic very center. But if you observe the right foot and the left foot is two different positions. In that situation, it's not coincidence, no sobreposition of the trace. We said in that case that it is a foot support who is not a good receptor. Another patient, as you see there, this patient, obviously we start to study first we studied the foot clinically. Yeah. You see, we studied the foot support and we study forward and back, one foot, another foot, and then on the back, and then on the back. Foot support clinically, and then we study that. Look at that foot is valgus varicenter, that is varus. We said in that case that is a disharmonic foot support. Sometimes it's a causative foot support. Imagine you can study with the instrument which kind of foot you have. Obviously, posturometry is not simple. You have to study. Yeah? We have a course of posturometry, and stabilometry, but it's a protocol. It's a special protocol, clinical protocol, instrumental protocol to arrive to the diagnosis. And with the instrument, we can do quick that diagnosis. Another patient, look at here, valgus is inside, varus inside this harmonic foot also, and scoliosis adaptative, connected with the posture. Look at here, another patient with postural alteration, and then the left foot. If you see here, this trace is smaller than this. When we see that, we see the foot is blocked, and then we can plan in a treatment for a blocked foot. It's an osteopathic treatment. You have to unblock it. But the proprioception is good because the two traces, blue and green, are in sobreposition. That means foot is blocked, but proprioception is working well. One and two. All right. Look at here, this harmonic foot. Valgus, varus, and you see scoliosis. Foot support connecting also with the scoliosis. What are the things we can measure? Scares. You know, the scares are creating also disturbs in our posture. It's interrupting the functionality of the energy, and we have to treat them if they are creating any problem. Sometimes they are not creating problem. You can individuate that. Look at how. Here, the mouth is open, and we test the scale. Look at here, no changes. The scale is not creating alteration. We have to leave it. But if it's creating alteration, we have to treat the scale. That is the concept. Measure, and you will arrive to exactly the diagnosis. And then look at here, craniofacial system, the big disturber of the posture. Yeah. The mandibular deviation here, you see that guy, this lady, mandibular deviation, retroposition of the jaw, unilateral hypoconvergence. This patient is a patient with postural alternation. And we can observe also in an X-ray. Yeah, you see that vertebral rotation here. Here you see the retroposition in the lateral view X-ray. Yoides in retroposition and very down. Rotation, problem with cervicals, blockage, patient with a lot of problems. Look at this frontal scoliosis, cervical scoliosis, rotation of the vertebra. This patient have problem in the craniofacial system. Now look at here, the posturometry. 2 kilos here, open mouth. When the patient is closing the mouth, 3 kilos. This mouth is creating problem to the posture and have to be annihilated. And look at what happened when we deprogram the mouth from 3 to 0. That is the effect of the body equilibrium device, bed device, annihilating the craniofacial system disturbing is creating good posture. Biochemistry. We have to measure also the biochemistry. Look at here. We did for this patient who we tested, she had an hypersensitivity of the foods. That was the beginning of the measure, and the patient have, very quick. The patient have 4 kilos overloading and less load. Have a problem in the posture, but what happened when we put the lady in contact with the foods? In the blood test, this patient have the onion with 1 cross hypersensibility. And if you see here, no significant variation. The rice, 2 crosses, increase overload on the right, 8 kilos, increase overload in the first metatarsus, and notice loss load in the frontal. Check 3 crosses hypersensibility. Here, overload is 11 kilos of instability. And with the placebo, taking a placebo was water. She doesn't know it was water. Water, no changes, you see? But when we did the homeopathy medicine, that's what we can, to clean the body, all situation is better. 0 and all 0, sorry, my mouse is very quick today, 0 and all good distribution. That means this medicine is giving good result for this patient. And then before finish, we analyze what happened with the teeth. We can measure that for dentists also. dentists can analyze the effect of the jaw position and the occlusion with the posturometer. I will show you how. Look at here. I analyze the trace. We have to see the areas of Capanghi. We have to study that. We have to study the oscillation, the barycenter, and the overload. And we will analyze them. Look at here. Open mouse, 1.7 kilos, 1.7. Close the mouse, immediately overload, 4.6. This craniofacial system is a cause of postural alteration. And we have to annulate it. And look at here. Was a study I did in 1990 regarding the pre-contacts of the teeth. You know, the teeth, when they touch first than the others, we call that pre-contact. The contact is first of the other. What happened with the contact is first? Imagine my hand, and here is pre-contact here. Oh, yeah, let me see. The pre-contact here. We cannot stand that there, the jaw chain position. And if the jaw chain position is creating problem in the posture. We studied that, creating artificial pre-contact in each teeth, and we measure what happened. And in all of these patients, anytime we create a pre-contact in the anterior area, that means anterior teeth from incisor to canine, the body loses load in the first metatarsal. When we create pre-contact in the area of the occlusal plane, that means first premolar, first molar, the body is losing weight in the fifth metatarsals. And when we're creating contacts in the posterior area of the mouth, that means second molar and third molar, they lose in the calcaneus. Schematically, it's like this. Pre-contacts here, anterior teeth, occlusal plane, posterior area, losing the body weight here. How is affecting? How is affecting? This area is affecting first metatarsus, fifth metatarsus, calcaneus. Look at how it's related. And look at what happened. This is a trace. Mouse open, mouse closed. Look at that. How it's changing the body weight and the torsion of the body. That is fantastic to see. Look at open mouse, closed mouse. Open mouse, closed mouse. The effect is showing the instrument the negative effect of the craniofacial system into the posture. We cannot investigate that if we want to have a good rehabilitation. Don't forget that. Measuring, you discover that, right? And look at here, before finish. That patient have, here, mouse open, 6.2 kilos, overload to the left. When the patient closes his mouse, the overload is, he loses here weight, pre-contact in the posterior area of the same side, second, third molar, and is creating overload the other side and increasing the overload to the left. As you see, measuring is the goal. That was a little webinar I try to show you in English because a lot of people told me, yeah, you always speak in Spanish. Spanish, we don't understand. Okay, I did it. I hope you enjoy it. Yeah? And if you need some topics I want to talk, just write to me. Yeah? In the YouTube channel, you can write to me the comments and I will do that. Okay. And I try to show you now our application. This is the application. Look at that. This is the web app, NPR International Academy, with a lot of courses. And we have a lot of free. If you put here free, you will arrive to here. Look at here, free. And you have a lot of information here for free. A lot. This webinar will be here tomorrow. The people who is registering our app, they will see that. And also we have a lot of courses, a lot of courses. If you scroll, you will see a lot of courses. Some of them free, some of them under payment, but this is our web application, the world of the NPR. Register is free. Registration is free. And just you need the email and your password, finish. You are in. And you will be informed all the things we talk. Okay, guys who stay there and the other who listen later, thank you so much for following the NPR International Academy. I am Professor Di Rocca, the director of the NPR, and every day I do in YouTube some information. You follow our channel and register in our channel. If you like the video, do a like, subscribe to the channel, click in the bell, and you will be informed. See you in the next presentation in our NPR International School. I hope you stay well, and I hope you enjoy the video. See you next time. Bye-bye, everybody. Until the next presentation in the NPR International School. Bye-bye.